Hi everyone, welcome to Archmaker. Today I am going to talk about something that most podiatrists don't talk about, which is how can we relieve pain with the way we lace our shoes. So I brought a typical shoe here. A few things I want to teach you. If you have any kind of bony deformity, which means that you look at your shoe, you have it on, you can see where a bone ends, like a bunion here, a hammer toe, which are the bent toes in here. First of all, you should always get a shoe wide enough and high enough that you don't see those bony deformities. But a shoe like this would be very good for you. This shoe is called a slipper fit shoe. Nike was one of the first to come out with these kinds of shoes. You notice the entire top of the shoe is one piece of fabric. There is no stitching whatsoever. If you have bony deformities, fabric is always better, and a high toe box always better. So among the deformities could be bunions, which stick out here, hammer toes, which you can see up here, high toe box. And a lot of my patients who are runners or are active, even in their shoes, they're feeling pain. Even with orthotics where we're dropping the joints, still pain. So what else can we do? One of the things you can do with any shoe is take the laces out. If you notice in this shoe, this laces start higher than the bony areas. So that's one thing you can do. Number two, you can lace differently. So most of us crisscross over areas that bother us. Remember, you can take it out and have the laces go up in different directions. So let me do this one for you. Sorry. All right, so here, if you notice, I'm lacing up the side of the shoe. You would do this, and you can, of course, do this on both sides. And then what you want to do, so let's do this from the other side as well. And you can go up on the sides as long as you want to avoid an area. Let's say this person has a high instep over here that bothers them. So this way you still want to go through the tongue so that the tongue gets held on both sides. But we can crisscross the tongue at any point, right? So in this way, if there's a high toe box or their instep begins to bother them there, I'm avoiding that by lacing these differently. And then up at the top, you definitely want to lace across the top so that it holds the ankle in, all right? But you can avoid a lot of things. Remember, it makes the tongue very adjustable. So if you have a high instep here, this tongue will actually move up. All right, so a lot of different ways like this. You can crisscross at the bottom, crisscross at the top, avoid the bony areas. And of course, if there are bony areas in the forefoot, try to get a shoe like this where the laces start up higher. Fabric, laces, try to pick a high toe box so that you do not see the bony deformities and you can lace to avoid your problem areas. I hope this helps.